Hello and welcome to We Can Learn to Learn. This week's interview is with Dr. Cyrus Safizadeh, a pediatric dentist, whom I met in New York when he was completing his dental residency at Columbia University, New York Presbyterian Hospital. It was a 2-year program and required for all pediatric dental specialists. Dr. Safizadeh subsequently founded Hampshire Meadow Family and Pediatric Dentistry, which is in Massachusetts. Dr. Safizadeh is fascinated and has had a lifelong passion for dentistry, and he feeds his interest by doing research and providing modernized care. His research projects have been on the subject on antibiotic prescribing practices and overuse, completed while at University of Connecticut, as well as examining the effectiveness of silver diamine fluoride, completed at Columbia University. Dr. Safizadeh is a proud member of the American Academy of Pediatric Dentistry, the American Dental Association, and the Massachusetts Dental Society. As I said, I met Dr. Safizadeh when he was here in New York during his residency, and here is our interview. Welcome to We Can Learn to Learn, Dr. Safizadeh. I wondered if you could tell us a little bit about how pediatric dentistry is different from regular dentistry, and what age groups you work with.
Sure. Well, thank you so much for having me, and I hope this can be helpful for some parents. As a pediatric dental resident and a future pediatric dentist, we receive specialty training to work with children from age 1 up to roughly 18 years old. At the hospital, we see children that have complicated medical histories, children who have severe decay or cavities, and children that have a really tough time due to anxiety being at the dentist. So we receive specialty training, additional 2 years to understand a child's psychology, their nutrition, what the sources of their disease are, and how to best address their needs. Additionally, as a dental resident for the main Children's Hospital in New York City, we're on call 24/7 for the Children's Hospital for any kind of dental emergency that would cause a patient to go to the emergency room.
But you don't do surgery?
So we do certain types of surgery, but if a child were to have a life-threatening infection, that would probably be coordinated where we would see the patient, triage the patient, and then move the patient up to the oral surgery department for certain very severe life-threatening infections. But we do significant management of dental injuries, infection management, and dental surgeries.
Okay. In my line of work as an early developmental learning specialist, I see many children with all kinds of what look like decaying teeth, broken teeth, blackened teeth, or they have several teeth pulled and others capped. Here are some examples that I'm showing you. I never know what to tell parents who say, my dentist tells me not to worry because these teeth fall out anyway. They are baby teeth and they're not that significant. What is your opinion about this?
So this is something, as a pediatric dentist, we are dealing with pretty much every day. Unfortunately, early childhood caries is one of the most prevalent diseases amongst children in the United States. There's a number of reasons why that's the case, but it is a serious problem for many young children. And in fact, over the last few decades, the incidence or the number of children that are suffering from this disease has actually been increasing.
Why do you think that's the case?
I think that has a lot to do with our diet in the United States, and maybe a lack of a lack of understanding of what's causing the disease, because it really shouldn't be going up when you consider all of the advances we're making as a country. It's a major problem. It is important to note, though, that as a problem, it economically is not even. So what I'm trying to say is that children of lower socioeconomic status are at much higher risk in the United States, and those are the groups where we're seeing the disease increase, whereas children of families that are well off and have more resources actually have seen a reduction in the disease.
I see. This is one of the reasons that I'm actually making this video, to help parents understand what to do with the best kind of health care for their children. I understand that it is recommended to have young children see the dentist and brush their teeth as soon as they have their first tooth, within the first year of their life. Mm-hmm. Could you tell us why baby teeth are so important? I mean, they fall out after a while anyway.
So again, this is, I love that you're bringing this up. It's something I love to talk about and I'm passionate about. So as you said, the recommendation by the American Academy of Pediatric Dentistry is for a child to see a dentist, could be a pediatric dentist, from the time when they get their first tooth, which is usually around 6 months and no later than 1 year. This appointment is very important. It's when we're evaluating the patient, since they might not have many teeth, the actually of what we're doing and the cleaning, it's very quick, but where the importance of this appointment is the time that the doctor has to speak with the parents, either the mom or the dad, so that everyone can be on the same page to try and avoid cavities before they begin. Because in dentistry, it really is all preventative. A small cavity is very easy to fix. It's also very easy to avoid in the first place. As they get larger, the treatment size or the treatment time, the amount of work that is necessary increases, and the prognosis for the teeth, or the probability of the baby teeth surviving, decreases, which brings me to the point, why are baby teeth important? So there's a number of reasons. The first is children go through 2 phases of losing their baby teeth. In the beginning, at 6 years, you tend to lose the 4 teeth in the front, on the top, and the bottom. And you gain an adult molar in the back. So you go, let's say a 7-year-old, a typical 7-year-old will now have gone from 20 baby teeth to 24 teeth, which are the 4 adult front teeth and 4 adult molars, and then the baby molars and the baby canines. So those teeth, the baby molars and the baby canines, those usually last in a child and are in the mouth until about, starting at 10 years old, they're lost, and the last one is usually lost or exfoliated by 12. So between that time, from 6 to 12 years old, those teeth are very important in the development of the jaw. They save the space for the adult teeth to come in. They are essentially the building blocks for the bone of the jaw for adulthood. So if you lose those teeth, you are at risk, and we see this happen a lot, unfortunately, is that the adult tooth that comes in the very back at 6 years old moves forward and takes the space of the adult premolars that are supposed to come in at around 11 or 12. It's a little hard to explain without diagrams, but yeah, that's one reason. The other reason is comes from a health standpoint. So cavities are a bacterial infection, and they're contagious. We actually catch them by being exposed to the environment. We pick up the bacteria. The food for the bacteria is sugar. So you can imagine how in our everyday lives, how much sugar we take in. Even if you're eating a healthy diet, you're still introducing sugar into your mouth, which is food for the bacteria. So it's never healthy to be walking around with a bacterial infection. So some cavities, unfortunately, grow to a size where they can affect the nerve. of the tooth, which starts to cause considerable pain and suffering for children. We have many young children who, after we complete their treatment, the parents report that they're eating much better. Because you can only imagine, if you've ever had a toothache as an adult, it must be the same for a child, a young child. And as a young child, you might have a harder time expressing that pain or what is causing it. Unfortunately, if the cavities continue to progress, the bacteria can actually leave the tooth and now go into the jaw. And this can cause an abscess in the jaw. So an abscess in the jaw, again, can be very uncomfortable and painful, and it can also cause more serious problems. It can damage the developing adult teeth, and it can also spread as an abscess. There's many different kinds of bacterial abscesses that a person can get, not just in your mouth, but you can only imagine that your mouth is a bad place to have an abscess because of its proximity or how close it is to your vital organs, being your brain and also your windpipe or airway. So for those reasons, if untreated, a dental abscess can become a life-threatening infection for a child, and it has happened, unfortunately, where these infections have gotten out of control. This is one of the reasons why we're on call for the hospitals. We do have children come in with what we call facial swellings, or their cheek, lips, part of their lower face is swollen due to a bacterial infection, and if you don't treat the cause quickly, it can spread, and especially in young children, these things can spread very quickly, and we have patients spending significant periods of time in the hospital to try and resolve these issues.
So in my case, where I see children, the pictures I showed you, where some of the teeth are actually have changed as a result of rot, or the teeth are blackened, or it's hard to describe. The children have like 8 capped teeth plus pulled teeth. Does that mean that their jaw is now at risk for not really reserving the space for adult teeth to come in?
So for many of those children, yes, that could be the situation. It's unfortunate. You always have to weigh the risks and benefits, and sometimes space loss is an unfortunate consequence of avoiding a serious dental infection or getting someone out of pain. If someone is not eating well because they're in tooth pain, sometimes that's an unfortunate consequence. However, we do have treatments that can help us prevent the space loss. We have space maintainers, which are devices that we make custom for children to kind of serve as the placeholder for the space that has been lost. Unfortunately, it's time and it's expensive, and it requires additional visits into the office for the children. So we would try our best to avoid these situations, but they are necessary. And unfortunately, if a child loses teeth before age 5, our ability to provide a space maintainer is compromised due to the lack of the teeth that we need to use the space maintainer being available. So it's unfortunate, it's the worst part of my job, but it is something that I see happening a lot at the hospital, unfortunately, due to the amount of disease we're seeing in our population.
Thank you for that explanation. I hope that parents
Yeah,
really...
and I don't mean to make it sound dark and gloomy, because we also have many patients who start seeing us at very young ages. My youngest patient today was probably 1 year and 2 months.
Oh, how cute.
And, you know, no cavities, but still doesn't have all his baby teeth. I was able to talk to mom about what my recommendations are so we can get on the same page and work to prevent cavities. And we have so many children who never have cavities, and we have, oftentimes these are the children, younger brother or sister of a child in our clinic who has had a lot of cavities. So the parents are now aware that this is completely preventable, and it really is. It's not a complicated disease. We know what causes it. We know what you can do to avoid it. You know, I can't guarantee that no one will ever get a cavity if they start coming and seeing a pediatric dentist early, but with the proper diet, hygiene, brushing at home, visits to the dentist, preventative treatments, the fluoride varnish that we have now, we can be very successful in providing cavities. And especially in New York State, now all children are covered under Medicaid. So, and we're not seeing the utilization of Medicaid where we would like it to be. So children that should be seen aren't always getting seen. So we'd like to just get the word out that almost all children in New York State have 2 preventative visits. If they're on Medicaid or a managed care program, they're eligible for preventative work as well as whatever restorable work they would need without too much out-of-pocket costs.
Well, that's very, very good news. Yeah. I hope that that this video interview with you is going to spread the possibility for parents to go and visit dentists without too much concern for the expense that it may have out of pocket. What are some pointers to help children avoid tooth decay? What did you tell this young mother of a 1-year-old? How early should children learn to floss?
So flossing is something we're concerned about with older children.
How old?
Probably, it really depends on their risk, but if I see a child starting to get cavities in between their teeth, I would then talk to a parent about flossing. I think even for brushing, a child can't brush their teeth well usually until they can tie their own shoes. Oh. So the parents really have to be involved. A lot of children love to be independent and yes. they like to brush their own teeth, and right. then they give parents a hard time yes. when they want to brush their teeth. Yes. So one thing we recommend is letting the child brush the teeth for maybe a minute and then having the parent go over for a minute and do a good job to make sure we're getting everything off. One thing that's difficult for many parents and a cause of severe cases that we see is the transition from a child to being a toddler, where as a baby they're used to having milk to go to sleep, milk waking up, and an infant, a young child, you know, less than 1 year, let's say a 4-month-old, needs to be fed throughout the night.
Yes.
Now let's take a 1.5-year-old toddler. Many of these children like and want that same diet.
Yes.
And you know, it could be from the bottle, it could be breastfeeding, it doesn't have to necessarily be milk. Maybe if they've developed a taste for juice, yes. it could be juice.
Yes.
And they can get very upset if they don't get, you know, this schedule of feeding. It is very important for that change to be made, however, because otherwise, not in every case, and certainly not, you know, I can't guarantee that this is what's going to happen, but that could be something that greatly increases a young child's risk of developing cavities and really bad cavities. The problem is with the baby teeth, as you could imagine, is they're much smaller and they're less resistant to the bacteria. So they can develop cavities and they can grow very quickly, much faster than on adult teeth. A few other things is the frequency of eating throughout the day.
Yeah. If
a child is drinking even a small cup of juice, but taking sips and walking around with a sippy cup for a prolonged period of time, even though it might not be that much juice, since they're prolonging the period of time that they're drinking it, that's going to greatly increase their risk of getting cavities. So it's a balance of frequency, diet.
I see. Right. What are your thoughts on sealants? You already talked a little bit about fluoride for young children. Could you tell us about enamel fluorosis and how to avoid it?
Yes, of course. So On sealants, it's pretty straightforward. The research has really proven that they're very effective in preventing cavities. What we do, and what, let's say you're on a managed healthcare program in New York State, your sealants are going to be covered on the first adult molar that comes in that we were talking about. That's at age 6.
Okay.
What sealants do is they seal the very deep grooves on this molar so that it makes it much harder for bacteria to get stuck in those grooves and cause cavities.
Okay.
So it's a pretty quick and easy procedure, and I would recommend it. It is something that really does prevent those serious cavities on the teeth that they're put on. In terms of enamel fluorosis. So enamel fluorosis is caused by the intake of too much fluoride. So fluoride in the city of New York is put into the tap water. Its level is managed at a level that would never cause fluorosis. And then in terms of using a fluoride toothpaste, if you use the amount prescribed by a pediatric dentist or a dentist for a young child, we would always recommend a level that wouldn't cause fluorosis. It's pretty much for a very young child, you're going to use half a grain of rice. So it's a tiny amount of toothpaste.
Wow.
And then, for a toddler, still about a grain of rice size. And you really have to just kind of make sure that you're not putting a ton of toothpaste on your on the child's toothpaste, and fluorosis should never really be a concern. It is something that can occur if someone intakes too much fluoride, though.
Okay. How often do you see that?
So fluorosis, we see it sometimes. Sometimes we also see it can be caused by maybe someone's diet or reasons that aren't exactly clear. Mm-hmm. So I don't think it's something we see too often.
Okay, that's good to know.
I think we kind of see it more maybe in older patients who have maybe had well water or something where the level of fluoride wasn't ever regulated. I see. So, it's not clear the level that they were ingesting.
Okay. So, speaking about sealants and how they seal the deepest grooves in your teeth, it made me think of children who may fall and chip their teeth, or maybe a tooth falls out as a result of an accident. What do you recommend that we do? Pick up the tooth that fell out, or the part of it that fell out, or take the... What do you recommend?
I, for the most part, would not recommend, if it's a baby tooth, especially one of the front teeth, putting it back in, mm-hmm. because you risk damage to the adult tooth that is in the bone. Okay. There. For an adult tooth, if that were to happen, I think it's very important. These are case-by-case basis, because nothing is ever the same. But it is very important to pick up the tooth, put it in some milk as quickly as possible, and go and see either your private dentist. Ideally, you'd have a private dentist you could go to, or you could go to an emergency room. It does depend on the hospital you go to, what dental services they would provide. If it's under an hour, an adult tooth that has come out completely, if it's put back in, has a higher chance of surviving. If you can have all this happen in under an hour, it is very hard to get to a hospital, be seen, and have that happen in under an hour. So it is something that is a little bit of an unfortunate situation.
Okay, that's good to know. Why milk?
So you could put it, essentially what you're trying to do is keep the tooth from drying out and keep the tooth alive. So you could put it in milk, you could actually put it in saliva. It's a little hard to get the amount of saliva you need to actually keep the tooth wet. There are other solutions that are even better than milk, but most people wouldn't just have those lying around.
No.
You know, they're solutions for either transporting organs or other solutions that are made specifically for this situation. But, you know, even as a pediatric dentist, I don't have that in my car.
Well, why not water?
So water could work, but it depends on, water doesn't have the balance of ions that you need that would be ideal for a living tooth.
Okay, well that's a new one on me. Thank you for that. Now, could you talk to us about medical trauma in children who undergo dental surgery and how parents could best prepare their children to avoid or at least minimize the trauma?
Of dental surgery?
Yes.
So I think the key is prevention of cavities. I can never predict how a child's going to respond in a dental setting. Yes. For some, it's more traumatic than others. Some children have more anxiety than others. Also, the severity of work and the need dictates how aggressive we have to be. If a child has a serious infection, our options are limited in what we can do.
Right.
So there's always sedation as an option. I think the most important things is honestly seeing dentists who take their time with children, customize the care to each child based on how nervous they are.
Yeah.
And also telling a child that it's going to be okay when they're at the dentist. We have a lot of parents who have anxiety of the dentist themselves and express that to their children.
Right.
And the children are very quick to pick up on this anxiety.
Sure.
So that's one unfortunate thing we see. We also see children being told by other children in school, oh, the dentist did this, the dentist did that. It's usually not positive things. And in general, in the media, dentists don't have the most positive image. So there's many places where children can pick up anxiety of the dental office. Another reason why for young children is just their interactions with the medical field on a whole is something that's scary for them. And so they have a natural level of anxiety when they come into our office. And it can be hard to manage at times. Pediatric dentists, we do have specialized training in behavior management and specialized techniques, but each child is different. And I'd love for all the children to have easy appointments, but that's not always the case.
Well, I have to tell you that I noticed that my preschoolers were bragging about the number of princess crowns they had in their mouth. So that was a very ingenious way of handling something that is pretty difficult to fix in a young child's mouth.
So we do try to let the children know that we are proud of their cooperation and their help that they give us, and we are always trying to think of ways to encourage them to be happy of a situation that wasn't necessarily the most ideal for them.
Right. How do you prepare young children for oral surgery though? Do you make an appointment with them ahead of time and use puppets or stories or before the actual date of the surgery?
So we put children to sleep under general anesthesia at the hospital. In general, we kind of tell the children that they're going to be put to sleep, and they're going to have all their teeth fixed. We talk to them a little bit about the process. Most of our patients are very, very young, so they don't fully comprehend the magnitude of what's happening. Most of the time is spent with the parents.
I see.
Discussing with them the procedure,
I see.
What's going to happen the day of, what they can expect the day after, and what the treatment plan is going to look like.
And can you talk to us a little bit about children with special needs, particularly those with autism, and how you recommend that parents take care of their teeth and their visits to dentists?
So as pediatric dentists, we receive, again, specialized training in working with children who have autism. It seems to be very prevalent at New York Presbyterian Hospital in terms of the patients that we see. We see a lot of patients that have autism. Since it's such a wide spectrum, it's hard to say exactly, because you could have one child who's really nonverbal and have another child who can really reason with us and speak, but have a very high level of anxiety or difficult tolerating treatment. For those children, especially the ones that either are nonverbal or have very high anxiety, I think for them the most important thing is prevention, which can be very difficult though, and limiting the number of cups of juice they have a day, making sure that the parents are brushing their teeth. It can be very hard. This can be a process that involves multiple parents or multiple people at home, because some of these children are very resistant to even having their teeth brushed at home.
Yeah.
So prevention for them is really one of the most important things.
Yeah.
Unfortunately, if these kids do develop dental problems, our options are limited, and we often have to use general anesthesia to try and complete their dental work.
Okay. Well, do you have any final comments that you would like to make?
I just think, I'd love for everyone to kind of understand that taking care of teeth is something that could be very easy, and most children don't have to have dental problems. But if they happen, we're here as pediatric dentists and dentists in general to try and work together as a team. I always love to kind of explain it as a team effort between the pediatric dentist, the child, and the parents. And we can all work together to either prevent cavities or deal with them as they arise, with treatment at home in terms of prevention and treatment in the office if necessary.
Okay, well, thank you so much for your time and your expertise. And I look forward to a follow-up should that come up.
Thank you.
Thank you.
Thank you.